ready? All right, it is 5 o'clock here in the Commonwealth. Time for us to get our update on this battle against COVID-19, and for us to remember that while some of the days are long, and while we have months to go until we see a vaccine, that we know that we will get through this, and we will get through this together. Say it with me, because it's true. We will get through this. We will get through this together. One last time, we will get through this. We will get through this together. We're going to get through this together because we've already shown that we have what it takes. And as long as we stay strong, and as long as we stay resilient, as long as we continue to be good neighbors and are committed to passing this test of humanity, that we can protect one another, and we can write our chapter in the history books about how to defeat a global pandemic. And how we're going to do that, how we're going to be that generation that's been able to do it like none other in history, is we're going to continue to follow the top 10 rules of defeating COVID-19. Number one is staying healthy at home. It's very important as we talk about healthy at work and more opportunity that we realize we still have to keep our contacts as low as possible. And the more that we are going to work and seeing other people there, the more we need to just come home afterwards. I know it's tough. I know we're all restless. But if we were going to face an adversary, if we were going to be tested as a generation, and ahead of time they said the way to defeat this is to make sure you stay home a lot, I think we would have taken it. So now we just got to be strong enough to continue to do what it takes. Avoid crowds and gatherings. As Healthy at Work starts again, we're going to have to remember this. If the break room has multiple people in it, you can't go. The break rooms ought to be generally shut down other than going in, getting food, the vending machine, etc. Social distancing, 6 feet or more, incredibly important. If it's office interactions or the rest, you have to have that 6 feet. While we all should be wearing masks, masks don't allow you to get closer. They simply keep you from infecting other people, even at that 6-foot distance. Knowing when to seek care, you all have been great about this. kycovid19.ky.gov is the definitive source for your information on the coronavirus. We will be posting, hopefully at the end of this week or at the latest at the beginning of next week, the guidance for retail, which is one of the next areas coming up, the guidance for opening state, city, and local governments. That's out for comment. And then we are working with a number of organizations on houses of worship, and that's been a very collaborative effort, and we want to make sure we get those right. Our hope is at the latest early next week, but everybody's on the same page. You'll find all that on the website. Washing your hands and surfaces. Anything we're going to open is going to have to be cleaned multiple times a day. And remember, it's not just the way you used to clean things. It's going to be every surface in any facility that anybody could touch has to be cleaned with at very least that 1-100 bleach solution, or a known disinfectant that can kill this virus. Again, if you can't do that, you can't meet those guidelines for reopening. Apply for benefits. Prioritize your mental health. I know harder and harder each of these days, so more important to do those small things to keep us strong and healthy, being able to communicate with our family and those around us. Make sure that you find things that bring you joy in the midst of this to keep us going. Don't travel. In fact, we issued a new travel ban today. We'd had a court that had said, well, there are just a few small issues. That was they said with a few small tweaks, it could go from being something that we don't think is acceptable to one that we think is. Basically, the court said, we think Ohio's is fine. We think yours should be more like Ohio's. So we've issued one today that's exactly like Ohio's. That's what the court says will work. That's what we'll do. What we have to make sure right now, with this virus not being gone, is somebody can't travel from one of the hot spots, Philadelphia or Boston or others right now, come into an area and continue to spread infection. It's the same reasons as before. We're doing a lot better inside of Kentucky. Let's just make sure it can't be frustrated where we are right now. And finally, reporting noncompliance. That'll be really important as we go back to Healthy at Work as well. These 10 rules, you've done an awesome, amazing, incredible job at making these muscle memory and making sure that you do the right things each and every day. Until it's defeated, these are the ways that you save lives. Doesn't have to be complicated to save lives. These are the ways that you do it. So we talk about our top 10 rules plus one. We got to fill out our census. We fell from 13th to 14th. Nobody wants to fall in the rankings. So I believe that if just 2% of Kentuckians got online today and filled out the census, I believe we'd be number 6 in the country. I'm not sure Kentucky's ever been number 6 in the census before. I think we can do it now. I think that would be pretty special. We've been recognized for different things over the last couple months, most of them good. It'd be nice for this to be the story of the 2020 census, how Kentucky outpaced anything that it had ever done, because we're Team Kentucky, and we're doing things together now. And we're putting divisions aside, and we're making sure we do what we have to do to protect each other. This will help us to make sure that we are successful moving forward. And so, as an extra message to make sure we get this done, we have one of our best messengers by video today, my senior advisor, Rocky Atkins.
I'm Rocky Atkins. A great honor for me to serve in the Kentucky House for 33 years. It's a great honor for me to work with Governor Andy Beshear as his senior advisor. I hope everyone across Kentucky is staying safe and healthy at home, but today I want to talk to my friends and neighbors in eastern Kentucky. We don't need to be undercounted again like we were in the 2010 census, and the reason this census is so important is that it is the amount of money through population that we get from the federal government for so many important services for our people throughout Kentucky. It matters when we want to have a strong voice in Washington, D.C. So when someone says, oh, that doesn't matter, yes, it does matter. So I'm here to challenge you as we work together as Team Kentucky. Go to 2020census.gov. It's important to all of us. Have a great day.
We thank Rocky. He's a huge part of Team Kentucky here. He's been a huge part of our response to COVID-19. So I know when I say things like we can't be doing that, that apparently I've said it a lot over the course of when we've been together. This is something that we can and we should and we must be doing. All right, so we also ask that people model that type of behavior that we need, that strength, that joy in caring about one another, about knowing that there's a better day ahead and doing what it takes to get by. So let's see what we have in today's social media. All right, today is National Nurses Day. Again, thank you to all of our nurses out there on the front lines. That may be one of the most dangerous times ever to be a nurse. But you have stepped up, you have done the work, and we appreciate you so very much. So let's take a pause right here, and let's learn our little bit of sign language today, which is going to be thank you, nurses. 2 fingers, okay, thank you, nurses. One more time. Thank you, nurses. And this is a very special thank you, I know. All right, this is one of our churches that is out there. We have featured them once before, but this is their 3rd round of giving. Just that spirit of Team Kentucky about what can we do to help those that have been harmed during COVID-19. This is living our faith. It's very special. And we're seeing this all across our different faiths. And it just shows what type of people that we are. And that while we might worship differently, we all care for our neighbor. And we're seeing that here in Kentucky. All right, this is apparently 6th grade ancient Greek mythology and kindergarten math. I'm probably better at one of those than the other. This is NTI. This is the type of work that our kids are getting in, and thank goodness for it. Yes, it isn't a substitute for an in-class experience, but it gives our kids structure. And I know my kids actually look forward to this every day. Thank you to all of our educators. Of course, this entire week is about teachers, so thank you once again. All right, and this is just another thank you. I've loved seeing this. You know, we have not fully appreciated the bond between our teachers and our kids, our future generations, until they couldn't be together. And I bet there aren't many people out there who will grumble again about going to school when we're able to resume next year. But we have actually seen so much caring and so many expressions of caring. It's been special. Oh, I appreciate this. This is our kids modeling the behavior we need to see here, wearing a mask, knowing that this is one of the most important things you can do to protect other people. And this girl is showing us that it doesn't take a lot, but it's something that can ensure, if you're asymptomatic, that you don't spread it to somebody that could lose their life or their health simply because we were too proud to wear one of these. Nice. This is our Kentucky State Parks, honoring those that have passed away from COVID-19. And we lost 14 Kentuckians yesterday. And so lighting our houses, our facilities, our institutions up green every night is another show of our strength, of our unity. Most of all, we truly care about those out there that are suffering from this loss. And then we have another video today that is in honor of National Interpreter Appreciation Day. It's a pretty special day, isn't it, Virginia? And I think this is a pretty special video. All right, so that was a hard video for those at home to see the way it came out, but I think hopefully it was very special to all of our interpreters out there. So I've got one other piece of sign language I want to learn today, and that is thank you, Virginia. Thank you, Virginia. And I bet some other people out there wanted to know how to say that too. All right, we're going to start doing our numbers closer to the top of the hour. And overall today, it's hard to say that there is such thing as a good day, but our numbers are back much more stabilized, showing that yesterday was a mixture of testing all of the Green River Correctional Facility where we expected a lot of positives, as well as a lot of tests coming in from the weekend. So today we're reporting 159 new cases of COVID-19. Obviously, that is half, a little less than half of yesterday. So we do still believe that we are pretty stabilized and pretty plateaued about where we are here in the Commonwealth. That brings us to our official number of 5,934 cases. That's after duplicates and the rest are removed. Of those, there are 3 probable cases and 5,931 lab-confirmed cases. Now, yesterday I told you when I read the total number of tests to date that we thought that we were missing some groups because it was lower than it should have been, and it was. So we've gone back, and while we still think we're missing a few, our total number of tests to date is 78,603. So that's up 17,590 from yesterday. And we found out where the reporting error was there. But, you know, this happens when you have this many labs that are reporting in. But it is closer to the new rate that we have, to our testing capacity, significantly going up. And we even believe that we're missing tests from this. So I tell you, again, it's hard to be excited about something during a time like this, but our testing capacity going from just what our lab could do to where we are today, and getting there because of partnerships with companies with a big presence in Kentucky, but because of labs, at least 3 labs and 2 research universities that stepped up and helped us in this time of need. That's a pretty special thing, that we face our challenges here in Kentucky as Kentuckians. And I'm very proud to be your governor, and I'm very proud of them and the service that they have provided. So 78,603 tests to date, and we still think that that is low. Number ever hospitalized in Kentucky, 1,616, currently 351. Ever in the ICU, 693, currently 190. Again, that's up. That's a number we don't like to see up. And let's think about those 190 people. I know our healthcare providers are working really hard to take care of them. Number recovered, this is the number we do like to see go up, 2,125. New cases by county, Jefferson 47, Warren 23, Kenton 15, Fayette 9, Hopkins 7, 6 in Davis and Muhlenberg, 5 in Boone, 4 in Bullitt and Campbell, 3 in Allen, Butler, Grayson, and Hardin, 2 in Breckenridge, Edmondson, Meade, and Webster, and 1 in Adair, Franklin, Grant, Henderson, LaRue, Laurel, Lincoln, Madison, McCracken, Pike, Shelby, Spencer, and Union. So while we've had overall in the number of cases, we've had a pretty good day to show that it is pretty stable. We have lost another 8 Kentuckians today. And these are 8 of us. These are 8 of our citizens that are gone too early. These are 8 families and 8 communities that are in mourning today. So again, let's light our houses up green. Let's ring our bells tomorrow at 10 a.m. And let's prove, no matter how many days I have to stand up here and read these, that we care just as much every day. I can tell you it hurts just as much every day, but let's show that we care just as much every day. Let's not have a set of families like these have a day where we're just too tired to do it. They need us. And the least that we can do for them is those small things, giving a call to a family that's going through this and making sure that we are there in their time of need. That's the type of people we are, and we don't get tired when it comes to something like this. So the individuals are a 73-year-old female from Russell, an 85-year-old female from Kenton, a 95-year-old female from Jackson, a 57-year-old female from Muhlenberg, a 63-year-old female from Muhlenberg, a 99-year-old female from Kenton, a 72-year-old female from Jefferson, and an 88-year-old female from Jackson. Breaking down ethnicity, race and ethnicity on total cases on race, 74.25% white, 13.83% black or African American, 6.24% Asian, 5.5% multiracial. On ethnicity, 88% non-Hispanic and about 12% Hispanic. On deaths, 78.49% white, 17.93% black or African American, 2.39% Asian, 1.19% multiracial. Looking at a couple of areas that we look at each time, long-term care facilities. The number of new cases is down, but as we look back over the last couple days, 8 new deaths there. Now, they're not new from what I've been reading. They've been individuals that we've read on previous nights, but just 14 new residents and 16 new staff. And folks, this is an issue all over the country. You may have read different articles about the numbers of additional folks in states that it's now coming out from these facilities that have been hit. We've been trying to be transparent with any of the information we have every day with you. This is our challenge. This is an area where this virus can absolutely devastate. Update on Green River. So we've tested over 1,000 people, inmates, staff, and contractors. The mass testing has been fully completed. And when the total numbers came in and duplicates were removed, they were actually down 10 from what we announced yesterday. 339 inmates and 50 staff. It's still almost 40% of everybody working or in the prison. 17 staff members have recovered and returned to work. And just think about that. They have recovered and they've gone back. That's pretty special to those 17 and to everybody else, that's fighting through this. It's brave, it's heroic, and thank you. Right now, the movements are being done to divide folks into different housing to ensure that we can better protect them and that we can continue to get a better hold of that situation. Testing. Today is the day, Wednesday, we announce our new locations for the next week for the Kroger sites. And so our locations for next week on the Kroger site, if you can pull that up, is we're actually going to be, I'll go ahead and announce for the next 2 weeks at the same Louisville location. We hadn't been anywhere for 2 weeks. This will be 4 weeks, but we are filling up. We're serving a lot of roles in that. It's both the largest city and we're serving a community, a traditionally African-American neighborhood, an area that we want to make sure, given the disproportionate impact on our African-American population, that we are locating our state testing where it is easiest. And I know that's being supplemented because there are challenges that this is only drive-through testing. So to Louisville Urban League and to a couple of our churches that have been out there supplementing it, I think U of L, Norton, the city have been doing that, Mayor Fisher, thank you. Again, we're all in this together and I think doing the right things together. Other locations for next week, another week in Lexington, Corbin, Tuesday through Thursday of next week, and Elizabethtown, Tuesday through Thursday of next week. So sign-ups are live now, right now, for these locations, and we need to fill all of them up, 400 plus every day. So get online for Louisville and Lexington, Monday through Friday next week, 400 slots and change every day. Corbin and Elizabethtown, same number of slots, Tuesday through Thursday. Let's not have any more no-shows. Let's get everybody through and get them tested. So the White House says we need to test 2% of our population every month. And we're ramping up to be able to hit almost 3, but only if people get tested. I do want to also, before we move on from this one, note that at these sites, we've been able to hand out masks, and we've been able to hand out hand sanitizer. And to date, through it, we've distributed 12,000 cotton masks and 20,000 bottles of hand sanitizer. It's just a way we're trying to help those. They're coming through to get tested, to make sure they have a little bit of the PPE that they need to move forward. All right, other testing locations. Let's put up. Okay, so this is Bowling Green. So Warren County and the surrounding area have been hit really hard, and we've moved the Kroger site for next week. So we worked with Judge Buchanan and others in Bowling Green to make sure that we had stable testing locations, and there's going to be a number. So for the rest of this week, Thursday still has our Kroger site, as does Friday, but there's also a Zip clinic on the Parker Bennett Elementary School, as well as another partner, Bluegrass Medical, Ely, or if it's Eli, I apologize, Drugs, will be holding it. And then next week, there are going to be hours, it looks like Monday, Tuesday, Thursday, and Friday in Bowling Green. This is the type of cooperation that's going to help us defeat COVID-19. We're having to move, our Kroger testing sites around different places, but when there's a need, this is the type of work where local leaders step up, local healthcare facilities step up, and we're able to work with them to help keep that coverage. Let's show all the locations again. Again, this is where we have testing this week. Think about where we started and where we've come from. I think we're 18 locations now. With Warren County's extra ones, we're probably close to 20 if you include all the different sites that they have. And we're getting some good test numbers that come back. I believe today, thus far, and these are just some of the Kroger locations, 338 in Louisville, 365 in Lexington, 277 in Bowling Green. A lot of that comes right at the end. 300 in Ashland thus far, which is good. Walgreens in Louisville, 231 yesterday. One area that can do a lot more is in Hazard. They've got some tests to spare. So primary care center there has drive-through testing that we want to take advantage of. But all of these folks are doing a great job. You can go to our website to see hours and how to sign up. Okay, I want Dr. Stack. He's got a couple different things that he's going to talk about. One is to go over, just again, briefly, healthcare phase 2. That started today, but it gives you a good idea of what's now open and available from your healthcare provider.
Thank you, Governor. I've got a few things on a lighter note. I'm wearing a wooden bow tie here. Now, Virginia, I'm told that, I have a sign language symbol now, which is based on my bow tie wearing, which, by the way, is only the third time I've worn a bow tie in about 2 months, but they are classy. So this bow tie was provided by Magnolia Woodwork in Crestwood, Kentucky, and they call it the Compassion Tie. It's got a green fabric in the middle here, and they donate a portion of the proceeds to the Team Kentucky Fund. So the governor has his cup, and thank you. Someone sent me a cup like the governor's too, but that's his, not mine, to share on the lectern here. But it's another example of Team Kentucky coming together, and they donate, like I said, a portion of the proceeds to the Team Kentucky Fund. So thank you for that. Healthcare has reopened for phase 2 today, and that means that elective and outpatient ambulatory surgery and invasive procedures were allowed to resume today. So this means pretty much same day or like less than 24-hour procedures can be performed in ambulatory surgery centers, in hospitals, and other facilities. In order to do this, they have to perform pre-procedure COVID-19 screening or testing based on specialty or professional society guidelines that are consistent with the Kentucky Department of Public Health guidance. They have to perform daily staff screening for fever and COVID-19 symptoms. They have to require universal masking of all staff, patients, and any others in the facility. They have to eliminate traditional waiting rooms and maintain social distancing in all settings where any waiting is required still. They have to maintain a 14-day supply of PPE based on that facility's specific anticipated burn rate for the next 2 weeks. And all acute care hospitals still have to preserve at least a 30% surge capacity in order to be prepared in case there was a COVID-19 surge. Next week on Wednesday, on the 13th rather, we will have phase 3, and we'll have more information on that at a later date. For the healthcare community, the executive order will probably come out by Friday afternoon, so you have that a few days in advance. Please, if you have a serious medical problem, seek medical care. We have been very consistent about this. I understand people are fearful. We have said all along on our slide that we used to show on a regular basis, if you would not have sought care were it not for COVID-19, don't seek care. Because if you feel like you have a cold, stay home and self-isolate. If you think you need medical care but are feeling generally okay, use telemedicine, telephone, some kind of telehealth. But if you think you have an emergency medical condition or you are having a serious medical problem, go seek care. Your hospitals and clinics and doctors are ready for you, and please go seek care. There are people who have stayed home for fear of the coronavirus, and we know that some of them have come sicker and suffered a worse outcome than they needed to. Please go seek care. The hospitals are there and they're ready for you, and you should have great faith and confidence in them. Speaking of which, Happy Nurses Day. I've spent an entire career working with nurses. 2 more things. I'm aware of frustrations that doctors, dentists, and others have with trying to get PPE and trying to get hand sanitizer and similar products. This is one of the things we've been very candid and transparent about. The supply chains are not where we want them to be. There is a great demand for reopening of things, but unless we can do it safely, consistent with Healthy at Work guidelines, using normal processes, it's just simply not possible for the federal and state government to provide supply chain for all of society. And so that's a good indicator for when society is ready to fully reopen or get closer to it with our new normal, is when the supply chains can provide what we need in order to safely return Healthy at Work. And the final thing I would say is we've received numerous calls today from citizens expressing concern about the Federal Medical Center in Fayette County. This is a federal facility, not a state facility, and we don't have jurisdiction over this federal facility. To express your concerns, please contact the federal government or your federal member of Congress, either your representative or your senator. The Lexington Fayette County Health Department is recommending that anyone who has worked at Lexington's Federal Medical Center since April 20th be tested for COVID-19 because they may have been potentially exposed during an outbreak at the facility. It is important to limit the spread of COVID-19 in the community. If you need help, please contact the Fayette County Health Department at 859-899-2222, and they will be happy to help you identify sources for testing options. And the final thing, please continue to comply with the Healthy at Home and Healthy at Work guidelines. Just because we are beginning to relax some requirements, it is not safe for those highest at risk to disregard these warnings. All the statistics we have show that for people who are over 60, this is a bad disease and you are at highest risk. If you are in a vulnerable category, over 60 or have major medical problems, you have to pay particular attention to following all of these requirements, because as people begin to engage a bit more in society, as we try to find ways to relax restrictions, you have to take special safeguards to keep yourself safe. So please continue to follow the guidance. Thank you very much, Governor.
If I can just add on that last point, I don't think we've emphasized it enough. Under the White House's guidance, the advice from our public health professionals, I said, just because May 11th is coming and you may fall in one of those areas, if you are over 60 or if you have heart, lung, or kidney disease, the recommendation is that you continue to stay healthy at home and not go be healthy at work. Let me just say, I know for a lot of people, work is a really important part of their identity. It's part of who they are. It's certainly part of who I am. But there's a lot more to the world, and there's a lot of people that love and care about you. And so I'd ask, if you fall into one of those categories, please don't rush back. It's not safe. Let's wait until another phase has come. There are kids, grandkids, and others that depend on you, that want to see you. Let's make sure that we follow the guidance that's out there. All right, we also have, in June, an election coming up. And I'm grateful that the Secretary of State worked with us, and that anybody that qualifies for the primary election is going to be able to vote via absentee. I'm waiting for the portal to come up that the Board of Elections is working on, and then I will show everybody how to go online and sign up to get their absentee ballot. You're also going to get a postcard in the mail that will advise you on how to do that too. One of our biggest challenges, one of the biggest concerns that I had about this election, and I've talked about it a lot, is the fact that we have a lot of poll workers that fall in this vulnerable category. Just about every poll worker where I used to vote would fall into that category. And how, because we have to have some limited amount of in-person voting, because there's some folks that might not even have a regular address, how we were going to do it safely. And then General Lamberton offered what I thought was a great solution when he offered the help of the National Guard in carrying out this election, using folks that we know are healthy, that have the PPE that is needed, and that are trained to take special safeguards. So we are now in very good discussions with the Secretary of State and others about how we can serve this role, ensure that those poll workers aren't placed in any type of situation that we would not want them to be in. And I'm really grateful that they made this offer that be done in the right way with people in civilian clothes, but a real opportunity to do this with a method where we know that people will be safer. So I wanted General Lamberton to say a few words because I will tell you, he came to me with this idea, and that's the exact type of leadership and servant leadership that we need.
Thank you, Governor. I appreciate it. As the Governor said, a lot of the folks who work in our polls, these are very much folks who are in our at-risk categories. And so with the impact of the pandemic, as many of you are already tracking, it already has impacted our election cycle, not only for the primary, but we'll see what occurs in the general election next fall as well. So quite simply, as many of you who are familiar with the Guard in particular, we literally are spread out over the entire state. And I would offer that we probably have soldiers or airmen who live in virtually all of 120 of our counties. So it quite simply is kind of a common sense solution for the issue. We've been in contact and already working with the executive director for the State Board of Elections. He in turn is going to share this information with all the county clerks through his exchanges with them. And that I would also offer, by virtue of speaking with the executive director, another concern that he shared with us is the prospect of a cyber threat to our election cycle. And in the National Guard, we've got what we refer to as CPTs, or cyber protection teams. These CPTs have a capability, an IT capability of simply getting together with various systems and assessing the vulnerability of these systems and perhaps offer some sort of a solution towards that resolution. And for those folks, whether it's engagement through the State Board of Elections to the county clerks, the best way to go ahead and engage us, if this is something you're interested in, work it through the executive director of the State Board of Elections. When we went into this agreement to address cyber threat issues across the Commonwealth, we did this in conjunction with the Commonwealth Office of Technology, the Kentucky Office of Homeland Security. So it's more than just your National Guard stepping out on it, but also if any local government is interested in engaging with our CPTs, work it through the Kentucky Office of Homeland Security or, once again, the State Board of Elections, and we'll be there for you. Thanks, sir.
Thank you. And let's remember who our Guard are. They're our neighbors, our friends. Sometimes they're our doctors, our veterinarians. They're people that work right alongside us. One of our paralegals in the Attorney General's office. These are folks we know, and they're folks that at times of crisis step up, put back on a uniform, and get the job done. So before anybody thinks that this is big government in any way, this is your neighbor. This is your neighbor who is volunteering and who is ready to help us out in this election. Also, register to vote. You still have time. You can do it online. This is part of your civic duty. Follow the 10 rules, fill out the census, and register to vote. These are just 3 hallmarks of citizenship in the world we live in right now that is easy to accomplish, especially when we're healthy at home and we have time. You still have until May 26th. elect.ky.gov. I've told you I'm not doing politics. This is a civic duty. Regardless of your party, you should register. You should vote. That's one of the things that makes our democracy so strong. On a lighter note, if I can, before we get to questions, I've learned that during this time, this is a pretty interesting job. Sometimes you get compliments for the things you do right, but you got to own the mistakes that you make too. And sometimes your mistakes end up on Jimmy Kimmel, and I am definitely the butt of that joke. And to Malik, Tupac Malik Shakur, again, I apologize, and he has been helped with his unemployment. But I do have to say, I never expected there to be a shirt with myself and Tupac on it. So I guess after you make a mistake like this, some things will never be the same. All right, today, here we've got Karen Czar, Mike Valente, Joe Ragusa, and Ben Tobin. And then we have a number of questions from folks that are not here and sent them in. So I will start them, and then I'll go Karen and around. This is from Danielle Grady at Leo Weekly. What do you think of summer camps that might want to open in June? Parents often use these camps as a form of childcare in the summer. Summer camps are going to be really hard in June. We can watch how the virus goes and hope for them a little later in the summer. What we're working on in June right now is trying to find a child care option that works. I can tell you, looking over at other states, most of them are either where we are, only for essential workers, or have been able to open up to a very limited amount of kids. And so we're working on that possibility right now. The next step in June in Phase 2. We hope to have a Phase 2 announcement this week on Friday. But it would be in Phase 2, and it would be basic child care. So I would not count on summer camps in June. Again, I'm not trying to ruin summer. The coronavirus is still here. It is still active. Karen.
Mine's a two-parter, so if you have to skip me on the way around, that's fine.
Okay.
And it's about travel. First of all, the travel ban, I know you mentioned mirroring Ohio and people traveling from hotspots. Can you give all the specifics so that everyone's clear of what's changed today again? And then I've had several families contact me saying they have family members who are snowbirds and have been in other states and staying put. When would they know it's a good time to come back because they have physicians here? And then do they need to quarantine other than seeing their physician?
So it's a question about, first, the specifics of the travel ban. We'll get you the written executive order, and that has all of it in there. It's very similar to what we have right now. It does make it more explicit that if you're just traveling through and for less than 24 hours, it doesn't apply to you. And it basically puts everything that judge said he thought we needed in there. I'm okay with taking a little bit of guidance if it helps us get where we need to go. So for grandparents or parents who are snowbirds, what we'd ask is that if they want to come back, but spend that 14 days just making sure, have friends and family help you with it to get groceries and the rest. And if there is a appointment that is critical to your health, you can go do the appointment that's critical to your health. We want you taken care of. If you need to go out and get food, go out and get food. But certainly limit those number of contacts just until we're sure. And again, it's one that people say, but I want to come back and I don't necessarily want to do that. What if? What if you are asymptomatic, bringing it back from a place that just has more of this? We want all our Kentuckians back home. I remember when the folks from the cruise ship were able to come back. I can tell you, they were okay to do the self-quarantine after finally being able to get back. Thank you to the Guard and so many others for making that happen. All right, Mike Savage from WEKU. WKYT reported today that an absentee ballot would need to be requested and in support of maximizing social distancing for the upcoming primary. If I'm already registered eligible to vote, why would I need to request an absentee ballot? That's the way the law works. We've been able to add a new reason for you to request it, and that's just that there's the coronavirus. And that is a big concession that the Secretary of State made so that we can be safe in this time. And it wasn't just him. I mean, everybody came to it. But still, under the law, you have to request the absentee ballot. And we're going to be showing you the portal where you can do that online. You're going to get the postcard that tells you how to do it. This should be a really easy step. As much as confirming your identity and saying, yes, there's a coronavirus, send me an absentee ballot. Now, the laws weren't totally changed. We don't have laws right now that allow us to do completely by mail. And even then, I don't know what the steps are in other states to get it, but a very small step to take. So, Joe?
Has the state made significant progress on those unresolved claims from March? I know there was a lot talked about yesterday, but I figured the first kind of round of people that made those corrections would
The question is on where are we on March claims. We are now really down to ones that either we have to get a person on the phone or through electronic means. And I know for those that have been waiting, they've been trying to get on the phone with us. But it's either because the wrong box has been checked, and that takes the person saying, we need to check the other one, or there's an employer verification issue. It's now, at this point, slow and steady progress. It's going to help us to get through those. Again, if you all have any specific stories or people that are calling that think they're hung up for another reason, let us know, and we'll try to take care of it. Phil Pendleton, some pastors are wanting to know if the state's going to post guidelines or give guidelines for churches not covered under an organization like the Council of Churches or the Baptist Convention. The answer is yes, and it'll be posted on the website. But I want everybody to know that we are working with so many different religious organizations, and everybody right now is proposing mostly the same things. One thing they wanted to make sure that I would say is that just because you can on May 20th doesn't mean that you're ready or that you have all the materials to make it safe or that you've had time to communicate with your congregation about the safety, especially for those in the most vulnerable population, or have talked enough about how service will be very different. So consult your faith leaders. First of all, I've been amazed and I'm grateful for the faith leaders across this state who, with the exception of just one house of worship, have all banded together to protect people. We would not have plateaued this curve without those faith leaders. And even now I'm seeing the type of care and compassion that they show, that they live out, that they help teach in the suggestions that we're getting back. My hope is at the latest we'll have that up on Monday, but we do want everybody to have the opportunity to comment. This shouldn't be just an agreement we reach with a single institution. Everybody ought to feel like they have had the opportunity, and that also gets buy-in of everybody wanting to do the right thing, agreeing that what it takes to make it safe. Mike?
So I know the state doesn't have jurisdiction over the federal medical center.
Yeah.
That facility is quickly becoming another hotspot. And Lexington city officials yesterday said they had to resort to this social media
Right.
campaign because they weren't getting much cooperation from administration at FMC. And they said they're pretty frustrated. Do you share some of those frustrations? And how has the cooperation been between both parties?
It's the question about the federal prison that has had the outbreak in Lexington, and the city's frustration with cooperation or lack of cooperation with the facility itself. I fully support Lexington and what they are trying to do. Mayor Gorton and I have talked about it. She's been fully transparent with me. She's trying to do the right thing. And so while we do not have jurisdiction over the inmates, we are offering for anyone and everyone who works there or who has come in contact with the facility, come get tested. Talk to your local health department. We want to help you. Now, it would be better if we could coordinate with the facility and get all of the employees tested. Those are our citizens. Those are our people. Many of them live in Fayette County. Some of them live in other areas. It'd be helpful if we get the type of cooperation so we don't impact their shifts and we can get everybody tested. But regardless, if you are one of our Kentuckians, we want to help you. Regardless of the level of cooperation we get from the facility, we want to help you and we want you to be safe. Okay. Did anything ever come out of the Midwest Governors Coronavirus Coalition? Yes. We are continuing to communicate, and we're continuing to talk about best practices. It gives us a chance to talk about some nuance. We get to watch what has worked and what has not worked. At the end of the day, we're all facing some different levels. I mean, here in Kentucky, we have, I think, the lowest or the second lowest level of many of those states. And so at the end of the day, we all make our individual nuanced decisions based on the culture within our states, but it has been very helpful. We received the Battelle mask sterilization machine. Did that come after conversations with Ohio Governor Mike DeWine? I believe that came to us directly from the federal government offering it to us and us accepting. Governor DeWine's been a great friend during this. We have had great communication, but I don't think he was directly related in this unless I'm unaware of it. This is a good program. It's going to help us to use N95 masks more and more. We need to take advantage of it. Ben.
So you talked about the primary elections earlier in Kentucky. Indiana said that would be reducing the number of polling locations. Do you plan to do the same in Kentucky, and if so, how many reductions do you plan to make?
The question is about the primary election and will we have fewer polling locations? That answer is most certainly yes. The clerks, the Board of Elections, and the Secretary of State are all working on that, and we're working with them to determine how many in each county. There's got to be at least one in each county, but then also what it'll look like. We still have some time to make it as safe as possible. Is there the opportunity for a drive-through voting if done the right way? How do we reduce the number of contacts? What do we do with the pencil? Right? Does somebody turn the pencil back in if you're filling out? So we're working on all of that. But yes, there will be fewer locations. But I'm going to be up here once the portal's ready, telling everybody every single day how to request and fill out the absentee ballot. And I'm going to encourage everybody that can to fill out that absentee ballot. It's by far the safest way. For you, it's the safest way. Even with the National Guard helping us out, your neighbors being in there that are trained and know how to do this safely. Let's make sure that we take advantage of this election, and I'm committing to vote by absentee ballot in this election. And I don't think my polling location will be open because that's the garage. We'll see. Restaurant owners are anxious for guidance on when and how to reopen. I hope that we will have phase 2 out at the latest on Friday. That'll include restaurants. So we will have some firm dates there, and then we will work on the guidance. I will say the association has given us some good thoughts. I'm not sure we agree with everything in them, but those conversations are ongoing. They will be in phase 2. We don't have dates yet. Gyms will be in phase 2. Movie theaters will be in phase 2. And we're trying to find a child care option for phase 2 as well. Several outlets have asked for a comment on First Liberty filing suit on behalf, is that the Liberty Council? Yeah. On behalf of Tabernacle Baptist Church, seeking a restraining order to allow in-person services. Now, we've now got, I think, 3 orders that say that we shouldn't be having in-person services, but we're 3 weeks away. We're just 3 weeks away from being able to do this with with a lot of our major associations helping out, working on ways to do this healthy. We want to get people back at the right levels and in a safe way to an in-person service, but only if the church is ready. And remember, it's not easy to meet these guidelines. I think about the size of my church and what it would take to use the type of industrial cleaner that we know can kill the virus on every single touchable surface. The amount of time, the amount of effort that'll take, and then thinking through when you sing in church, you spray. No matter how well we all sing, and I don't sing well at all, but my kids do. We spray, and so thinking about that piece, looking at how you're going to spread people out as they come in and out. Looking at it's not as easy to say, well, we'll sit 6 feet apart from each other. Well, what about front and back? That 6 feet matters there too. Figuring out, even when we set some capacity level, if you can even hit that number based on kind of that circle of 6 feet. So there's a lot here, and I just request everybody spend the next couple weeks, because you've been doing that virtual service or that drive-in service, figuring out the best way to do it. But I will say, even on May 20th, that the safest way to worship will still be virtually. The second safest way to worship will be a drive-in service. And I've been encouraging those all along, so if you're doing them and they're working, keep doing them. But then we're going to get to a place where we're going to have clear guidance that folks can follow. So the question is, do we rush to it when everybody hasn't been heard and we haven't been able to get out the best way to do it, or do we do it safely? Karen? Oh, the answer is we do it safely.
You touched on it earlier, and you've been talking about this for a few weeks, of extending more testing within the African American community. And you mentioned that churches were supplementing. Does that mean they're helping getting people to the location? Because I know drive-up has been an issue.
Yeah, it's both. The question is, in trying to provide testing to underserved areas, our predominantly African American neighborhoods, the churches that have been helping out, what have they been doing? They've been doing a couple things. Number one, they've been helping the people sign up and get them to the drive-through testing. St. Stephen's in Louisville hosted one, and I know they weren't the only partner in that on their grounds. Actually, they may have done it twice, that allowed walk-ups. That was in conjunction at least one time, I believe, with U of L and Norton and others. And that's where we need to go to build. The state's going to be able to provide some level. I hope tomorrow that we have a pretty good announcement on a private partnership. It's going to be able to do some testing. And then our localities, just like when we look at all 18 of those, being able to supplement from there. And there's no question that drive-through facilities, they serve probably the maximum number of people with the least amount of PPE. But there are issues there. They don't serve everybody, and we need to get to a place where we can have options for everybody. The Shawnee testing site's turning away people who walk up. That's exactly what we're talking about right now. It's one of the challenges with that model, but they are not folks that are being counted as no-shows. So a couple things that we're trying to do with local governments is where we can provide testing to. They could even be tactical units that can go out in communities and try to work to find those walk-up service capabilities. Joe.
As we're doing the return to work and everything, obviously the unemployment system is going to be, or rather be requiring employers and employees to start filing return to work dates. Given that, and given the overloaded unemployment system that we've been dealing with for the last couple of months, are you worried about even more problems with unemployment as we're slowly, gradually bringing these businesses back?
I worry about unemployment every day. We have faced a record number of claims, and now we'll have people going back. We have processed more than just about any other state, but it's not enough. I'm not satisfied. We're not supposed to make excuses. We're supposed to get everybody helped, and we haven't done a good enough job at that. That is not a criticism of anybody working over there, but it's just that this is our duty, and it's my duty, and we need to do better. And as there are additional complications, I hope we rise to the challenge and we don't see additional delays. The best we can do is work as hard as we can on it, be as smart as we can to address it. Viewers have been calling us asking if it is safe for them to return to work if they are at an at-risk group but healthy. The CDC says no. The White House says no. They say that you really need to stay healthy at home for this period of time. I know that's hard, and remember, lots of people are asymptomatic, but that is the recommendation. Ben, final one.
I wanted to return to the lawsuit from the church earlier. They said that virtual services and driving services quote do not meet the Lord's requirements. Governor Beshear, I know before you said that you're a man of faith. I was just wondering, what do you make of that?
Yeah, the question is, I think the new lawsuit, which I haven't read, says that virtual services and drive-in services don't meet the Lord's requirement, and that's their words. I just want to make sure. Okay. And the question was, what do I think of that? My faith is very important to me, very important to my family. And we have had to change the way we worship because we go every Sunday and the kids go every Wednesday night, and oftentimes we have more activities than that. My son's baptism has been put off. They're the leads in the church musical this year. They've been waiting their entire lives, if you think about it, to be those leads. But I know we're doing the right thing. I believe that God gives us wisdom to do the right thing, and the most important commandment, as Jesus put out there, was to love your God with all your heart, but also to love your neighbor as yourself. I want to make sure we're not doing things that hurt our neighbor. And I know that those that have been doing the virtual services and the drive-in services have been protecting their flock. Again, I just ask this group, nobody can meet the CDC guidelines tomorrow. I mean, they may think that they can because you hear 6 feet apart. It's a lot more than that. So take the time, continue to do the virtual services or drive-in service if you've just been doing virtual. That'll be new. But make sure that when you reopen your church, that it doesn't end up causing harm to people in your congregation. The last thing that we ought to want, without having the final guidelines that are out there, is to rush to a reopening and then it spreads throughout the church and throughout the community. Let's just do it safely. Let's do it right. I think that's what we're called to do.
Can I get a second?
Okay, one last one. That's cheating.
This may be a question for you and Dr. Stack. New York Department of Health has issued an advisory to doctors about a mysterious illness and inflammatory syndrome that may be connected to COVID-19. And there's about 15 hospitalizations, younger kids. And previously we had thought that it didn't really affect children.
Right.
Have you seen any symptoms in this state?
I don't think we have. We don't have any reported symptoms of that here in Kentucky. All right, folks. I think I'm actually getting us out on time for once. Keep it up. Keep doing great work. We are a great generation. We are going to be remembered as the kindest generation. I know there's anxiety. I know we're worried about the economy, and we should be. But we are doing the right thing by our morals, by our ethics, and by one another. The test of humanity is about the type of neighbor, but also the type of person that each and every one of us are. Your decisions every day matter. They are the decisions that can be the life and death of another person. So let's not get tired knowing what the stakes are. Let's just continue to be great Kentuckians. We've got a really special video to close on that I'm supposed to have a lead-in for that I'm having trouble finding, and I know we're late. This is Gilda's Club, which does amazing work around Kentucky. I know a lot of people came together to make this happen, including the Abramsons, who have been wonderful public servants, and actually were driving around the community to make sure people had these green lights. This is an organization that understands compassion and has displayed it for a long time. And they're just helping us to lead the way now. See you at 5.
There's no combination of words I could put on the back of a postcard. No song that I could sing, but I can try for your heart. And our dreams, and they are made out of real things, like a shoebox of photographs with sepia tone loving. Love is the answer, at least, for most of the questions in my heart. Like, why are we here and where do we go? And knock on me so hard. It's not always easy, and sometimes life can be deceiving. I'll tell you one thing, it's always better when we're together. It's always better when we're together. Yeah, we'll look at them stars and we're together. Well, it's always better when we're together. Yeah, it's always better when we're together. And all of these moments just might find their way into my dreams tonight. But I know that they'll be gone when the morning light sings or brings new things. For tomorrow night you see that they'll be gone too. Too many things I have to do. But if all of these dreams might find their way into my day-to-day scene, I'd be under the impression I was somewhere in between, with only two, just me and you. Not so many things we got to do, or places we got to be. We'll sit beneath the